Hello, and welcome to this series on helping dancers help themselves, mental health, and performing artists. I'm Dr. Nancy Cadle, and today we're going to explore depression, the dark night of the soul. I have with me Dr. Bonnie Robson, Paula Thompson, Linda Mannering, and Mr. Peter Luton-Brain, the president of the International Association for Dance Medicine and Science. These webinar recordings have been made available through a mental health working group arising from the International Association for Dance Medicine and Science. We hope to provide mental health tips, explore mental health issues that may arise from the consequences of a crisis, and promote resilience in the face of difficult times. Remember that the presenters are fully aware that these experiences are highly individual and that any suggestion may not work for every individual. Links of these recordings will be available and shared on the iAtoms app, YouTube channel, Facebook page, and Instagram. So we have a dancer who raised a concern with this following question. The dancer wrote, "As a teenager, I struggled with bouts of depression. I'm now feeling the same way. It's difficult to get out of bed. I'm not motivated to dance anymore, and everything just feels gray and dull. Does this sound like my depression has returned? I believed it was something I left behind in my adolescence." So I think first let's start with Peter. Peter, you already mentioned in some earlier webinars that dancers can have difficulty talking about their problems. Would you say that it's easy to tell when a dancer in your class or company is feeling depressed?
That's a great question, Nancy. Yeah, the thing with dance is it's a form of nonverbal communication. So dancers love to move and express themselves, but talking is another matter. A dancer once said to me, "If I could talk, I wouldn't be dancing." So it's this constant trying to find words, which may be hard for them. So sometimes it might be easier to see in their dancing what they're feeling than actually the words. Because often you can ask a dancer and they'll all say, "I'm fine." So this whole notion of nonverbal communication and people practicing all day to communicate with their bodies, but not with words, can be increased when we add the multicultural aspect of dance. And the great thing at dance school or companies, you have people from all over the world because they're not using language. They're expressing themselves. It can be really challenging for a teacher or a therapist or even a director to understand when there's a call for help. And that can be very challenging. And I know personally from working with dancers, sometimes it's very confusing to know what they're saying. They might be able to express something physically very easily, but something emotionally or psychologically is another matter. And that's why we really need your help to help us sometimes interpret these signs, because they're not always easy to understand.
Thank you, Peter. So it's quite difficult sometimes to understand if a dancer that you're working with is depressed. Paula, do you think you can help us understand what these differences between the normal feeling of depression and when someone really needs to seek professional help?
Sure, thanks, Nancy. Yeah, the languaging of depression has a wide range of meanings. Many people will say, "Oh, I'm feeling depressed." They wake up in the morning and they're feeling depressed. Or in the middle of the day, they get some bad news and they say, "I'm so depressed." That's very different than when somebody has a medical condition, which is called clinical depression. So if you're having that normal state of depression, it's all very easy to say to somebody who has clinical depression, "Well, you'll feel better tomorrow, don't worry about it." And that's just not the case. They're not going to feel better, and it actually makes them feel even worse. So we have to be careful of our languaging. The other thing is different cultures perceive depression slightly through a different lens. So in some cultures, there's more focus on the somatic symptoms, where they feel nauseous, they feel low energy, they feel ill, whereas others may be focusing more on the psychological components, that they're feeling unable to make decisions, they're feeling agitated, restless. So it's differentiating what each culture perceives is clinical depression. Generally, though, clinical depression is having the following 5 or more symptoms every day, throughout the day, and it lasts at least 2 weeks. So what are these symptoms? A low mood, which we just described, a decrease in interest in the things that we normally find pleasurable, especially for dancers where you once loved dancing, it's no longer enjoyable. Different changes in weight and appetite, maybe more or maybe less. Same with sleep. You may be sleeping more or less. You may be feeling more agitated, or the contrary, you feel like you have less energy. Some may feel incredible fatigue and loss of energy throughout the day. Oftentimes, there's a feeling of worthlessness, that you just don't matter. And there can be an excessive feeling of guilt. You're just worried all the time that you did something wrong. So there's that perseverating. There's a difficulty in concentrating, and that leads to trouble making decisions. And oftentimes with clinical depression, there's thoughts of suicide that creep in, so that you're wandering around through the day and thinking, I might be better just off being dead. Or, oh, if I were dead, I wouldn't have to feel this way. That goes hand in hand with clinical depression, and it can get very, very severe. So what you want to also know with depression is that sometimes it can be more, it's called disruptive mood dysregulation disorder. You're not showing those symptoms, but you're having a lot of temper outbursts, and that can mask as dysregulated emotions, when in fact you're really depressed. You're just showing them through temper. For some who have really severe premenstrual symptoms, you're actually verging into those more depressed symptoms, and there's treatments for that premenstrual disorder. People who have seasonal patterns of depression, as winter comes along, you're starting to feel depression creeping in, and as winter gets even longer, the days are shorter, you're feeling more and more depressed. That's a seasonal pattern of depression. And for some, there can be a persistent depressive disorder that lasts most days for more than 2 years, and then that becomes a different category of depression. And lastly, some medications or recreational drugs or some medical conditions can actually cause depression, like heart disease, for example, can cause depression. So when you have a major depressive disorder, it is diagnosed by a medical doctor or psychologist, licensed clinician, mental health worker. They usually look at it in a range of mild, moderate, or severe. The mild ones can be managed with a lot of different treatment modalities, but when you move into the moderate or severe, then you're needing more and more professional help. For some, it might be their first episode. Others, it may be recurrent, and still others, it may be persisting. And oftentimes, depression can co-occur with anxiety or any other of the psychological disorders. So depression is not just a standalone for many people. The good news is for dancers that if it's in the mild range, dancing can actually help alleviate some of these symptoms. But when it moves into the moderate or severe, dancing becomes really, really difficult. There's no shame around that. Just get somebody to help you. And with the right treatment, you can get back to dancing and your depression will remit or hopefully diminish. So, Nancy, I hope that helps clarify how we're using depression versus clinical depression, which is a medical illness. So I'm turning it back to you. Thank you.
Thank you, Paula. I know we've all had bouts of feeling low or depressed, but those clear definitions of all those aspects that contribute to what you call clinical depression is extremely helpful for us to understand that they're really two different things. Just feeling depressed and actually being clinically depressed are very different. And so I think that's quite helpful. And now, so Bonnie, as a retired psychiatrist and medical doctor, do you have any insights on how medical doctors typically would treat a clinical depression?
Thank you, Nancy. I think I do. The dancer you described, who had previous depressive episode in her teens and was down and spending most of her time in bed, she should be seen by a physician or a psychiatric or medical clinic. As with most medical disorders, the earlier she can be assessed and treatment started, the better chances she will have of recovery, usually. Treatment for depression is not just antidepressant medication. As a disorder that combines genetic and environmental factors, the therapy may include any or all of, or one of, education, biological, physiological, psychological, and physical treatment. If someone is depressed, education about the signs and symptoms and normal course of the illness and about the importance of family history can be very useful. Why family history? Depression is a family disorder. It's familial. So certain features of the disorder, say insomnia, will be more likely to occur if a relative has had the same pattern. And importantly, close relatives are more likely to respond to the same treatment or medication. So it's very important. Have a primary physician who is willing to take the time to explain the diagnosis and treatment recommendations is very helpful. The physician may want to refer the dancer to a psychiatrist or mental health facility. The dancer can ask if the specialist they're going to see has experience in working with dancers. Very important. During the wait, the dancer may be put on medication to help some of the symptoms, preferably one that might have worked in the past, or if this is a first experience, the medication will target probably the most troubling symptoms. Antidepressant medications can take a while to work fully. And during this time, the physician is probably going to adjust the medication, increasing the dose, decreasing the dose, maybe even changing it if side effects warrant that. There are surveys available that help track the progress of the person being treated based on the severity of symptoms. And by all means, if you have an opportunity to do the survey, this will give you an idea of how it's working for you personally. Other dancers may not be able to cope with a full schedule of class and rehearsal and performance during this time. If the physician is familiar with working with dancers, they can help with the decision as how much the dancer should expect of herself. It may be enough to do class and watch rehearsal. Maybe the dancer should take time away and spend time with family, returning home and seeking medical consultation in a familiar environment, and with the help of family and friends, get back to dancing quicker. Of course, this depends on the family circumstances. Again, as Peter Luton Brain says, the dancer needs to guide the physician in what she needs for herself and to speak up. Physicians are often not aware of the stress the dancer feels when they are not dancing, and the fear that they will fall behind others and that the choreographer will forget who they are. And these are real fears. An important part of the recovery plan is that the dancer needs to let the physician know this. The dancer also has to consider her contract and the provisions for compensation, but may not be able to complete the paperwork and has to ask for help, as this is essential. Paula Thompson tells us that exercise, and specifically dance, is therapeutic. Dancers know that in times of stress, internal or community-based, access to a dance class can lift the spirits. And so this needs to be considered and part of the balance as to how much you're going to dance. First, I need to talk to you about the question of risk of self-harm. Individuals who are depressed are likely to have thoughts of death and may have suicidal thoughts and suicidal plans. Some things need to be considered as high risk for suicide. If a dancer is depressed, the use of alcohol and other substances, feeling hopeless, has attempted suicide before, or has a family member who's attempted suicide, has had a major loss recently of someone they've been close to. If the dancer's talking about wanting to die, does she have a plan? And is it possible? Does she have the means to carry out the plan? Has the dancer withdrawn from friends and family? Is the dancer giving away her possessions? It is important to ascertain if the person is contemplating harming themselves. Be upfront with your friend or another dancer. Ask. A fellow dancer may be able to talk to another dancer where they can't share with anyone else. The dancer needs to be seen in the emergency room in the instance of high risk, or a mental health center. If the dancer refuses to go, call a hotline or emergency services. Get help. The dancer should never be left alone. Now, I want to reiterate something we talked about earlier in our series on mental health. Because depression has a tendency to relapse and come back, particularly when a person is under a stressful situation, it's important to keep records of what has happened to you in your struggle with depression. So encourage other dancers to keep a journal, write down medications that were helpful and not helpful, and so on. And in the event that there is a relapse or recurrence of symptoms, you will have that record readily available. Nancy, that's what a physician's perspective would be, I think.
Thank you, Bonnie. That's so helpful. It sounds like there's a lot of different treatments that are available, and one may not work for you, but don't despair because there are others that might be tried. And also, thank you so much for giving us a plan. If someone we know is suicidal or thinking about hurting themselves, it really helps that we have some steps we can take and things we can do to try and help them out of that situation. So I really appreciate that, Bonnie. So I think next, Linda, I was wondering if you have some other tools that you could offer us that may be of help when someone is struggling from clinical depression.
Thank you, Nancy. Yes, I'll try and provide a few other tools whereby dancers or us as individuals can actually help ourselves. And I'd like to begin with mental health support. And Bonnie mentioned how important that was, and Paula mentioned it in the face of depression, clinical depression. And I'd just like to say that there are many kinds of mental health therapies. There are various effective therapies that have good research, solid research to suggest that they are very effective with helping individuals with depression. For example, there is evidence that mindfulness-based therapies will help people with depression. There's a great abundance of research showing that cognitive behavioral therapy is a very effective modality for working with depression of all levels, mild, moderate, or severe, as well as compassion-based therapy and acceptance, compassion, commitment kinds of therapies. And I'd like to point out that these therapies are quite varied, and it's important for individuals to find a therapeutic alliance that works for them, because research has indicated how important the therapeutic relationship is. That is one of the most important components of working with somebody in talk therapy. So find somebody with whom you can connect, you feel supported, and you trust. And it doesn't really matter what kind of therapy they may be doing, because each of us works very differently. It's important that you can connect with that person and be very honest with them and go to them in your time of need. The second tool that I think is critical for dancers is physical activity, exercise, dance. And there are a number of studies that actually have shown that exercise is very efficacious for decreasing depressive symptomatology. And the interventions that might work very effectively may combine exercise. So psychotherapy plus antidepressant medication plus exercise. As Bonnie mentioned, sometimes it takes a while for medication to kick in. So if you can do some exercise to try and get yourself over that little bump until the medication kicks in, or maybe if you have a mild or a moderate form of depression, you may be able to manage that with a appropriate physician, psychologist, or psychiatrist, you may be able to manage that effectively with only exercise. We know that exercise is very effective for mild depression and also for moderate depression. There are a number of things that exercise will do physiologically to help cardiovascular fitness, to help the system create an adaptation or an homeostasis effect in response to stress. We also know that exercise, physical activity, will give you a boost in your neurons. It creates neurogenesis, and it also helps to reduce inflammation. So there are many, many bonuses from doing physical exercise, as well as helping you feel calmer, helping you have a sense of well-being, and it can also serve as a distraction for that incessant feeling of fatigue. Now, I'd just like to mention that these activities will help to release dopamine, norepinephrine, and serotonin, these neural chemicals, these mood regulators, which Bonnie talked about. And they will also, if you do exercise, help you help you sleep better. Exercise has been well known to increase your sleep, and if you're sleeping too much, it may help you regulate your sleep patterns as well. Now, with severe depression, a combination of suitable medication and exercise is probably the most useful. And I'd like to mention that prescribing exercise is actually more complicated than just saying get up and go and exercise. When you're severely depressed, exhausted, fatigued, and you might not be able to get out of bed, you might not be able to brush your teeth, you don't want to eat, or maybe you're eating too much. There are enormous things that happen to you when you're severely depressed. And so if I say to you, you must get out and exercise, you're going to say, wait a minute, I can't even get dressed properly. So we have to be very mindful of individuals and how exercise is very beneficial, but we have to start slowly. And exercise, when we're prescribing exercise, when I prescribe it to some of my clients, I make sure that the exercise is very enjoyable. People want to do it. It's convenient. You don't have to get dressed and go down the block and get in the car and get to the exercise studio. It's easy, and that it's energizing. So you want to feel uplifted. So let's start with a severely depressed individual. If you are severely depressed, you may want to start an exercise program with 1 minute of floor bar, maybe 2 minutes if you're lucky. And I like to start with lying on the floor and just breathing and feeling yourself on the floor in your alignment, doing your breathing exercises, maybe doing a few arm exercises or head exercises. Those are going to be incredibly effective. You may only have 2 minutes, but at least you've started. So we have to be mindful of that exercise, when we prescribe it, like dance, needs to be enjoyable, needs to be convenient, easy, and energizing. We did some research a little while ago that showed with the regular population, people who had low mood and engaged in a 10-minute walk, their mood was elevated. Now, we didn't follow up for weeks and months afterwards, but in the short term, mood was enhanced. So we do know that exercise, dance, physical activity will enhance our feelings of well-being. How much do we do? It's a complex story when we're talking about depression. So you may want to give yourself a break and say, I'm going to start with once a week or twice a week, perhaps 3 times a week if we can manage it, working for 5-10 minutes and building up. So you want to do something that is manageable. We know that exercise for a 12-24 week period, 3 times a week, for about 20 minutes will definitely enhance your mood, but you have to persist at it. It's something that you can't do now and again. It's something that needs the intensity and the frequency and the duration. Now, what the problem is when we are looking at somebody prescribing exercise for us, we have to be mindful that psychologists and psychiatrists and physicians typically are not well trained in exercise prescription. It's getting better, but even more so, they are not educated to the extent maybe some of us are in what dancers need. So it's important that your therapist has an understanding of who you are as a dancer, what physical activity means, and that physical activity and dance are incredibly important to you, and that they can help you with appropriate exercise, and they can manage those effects for you in some way. So that's exercise. So we've talked about mental health, psychotherapies, how effective they are. We talked about exercise, how important that is for us to help ourselves. And the other two things I'd like to mention, actually three things, is light therapy. Getting outside into the natural daylight, sunshine, is very, very important for the brain. It helps us regulate sleep. It helps us regulate mood. So if you can get outside for 20 minutes to get your vitamin D, as well as the light that goes in through the retina, and it goes to the pineal gland, and it helps with the melatonin development. We need to get appropriate sunlight, and that may help us with our mood and depression, because when we're depressed, we just want to stay in, withdraw, get under our blankets and stay there. So if we can motivate ourselves to get outside, go for a walk would be superb, but maybe you can't do that. Stand on your balcony, stand in your garden, do a few deep breaths. Getting that sunlight is very important. There are also light therapies. You can buy special lights to help you. And I have a word of caution. We have to make sure that we are under appropriate supervision when we use these kind of modalities, because they can have an opposite effect and cause a great deal of agitation. But seasonal affective disorder is one kind of depression that has for years been helped with light therapy. And the light therapy we're talking about is a light that has greater than or 10,000 luxes or lumens. So when we're sitting inside, when our fluorescent lights are on and we've got all the lights blazing, that is still very low lumen, and it's not sufficient, which is why I suggest that you get outside. These light therapy devices are they're developed with an appropriate level of lux so that you can actually get the benefit from bright daylight kinds of light sources. So that's the second or third modality that I'd like to mention. And the two other ones that have been mentioned very briefly are social supports. Bonnie mentioned this, how important it is to reach out to friends. So I'm not going to go over that. It was covered very nicely. And the other one I'd lastly like to mention is nutrition, how important it is for us to make sure that we're getting the appropriate nutrition. Because when we're feeling depressed, as Paula said, we'll either eat too much or eat not enough. And the body and mood is affected by what we put in. It's like the computer. Garbage in, garbage out. So we want to make sure that we are having appropriate food sources, that we can develop those neurotransmitters, develop all the hormones and the chemicals and the enzymes that our body needs just to function normally. So those are the four that I mentioned today that I think are very important.
That's wonderful, Linda. Thank you for all those helpful tools for us to help ourselves. Certainly, we can look at our nutrition, look at how much light we're getting, and even simple exercise like a walk, which might be something simple that we can do to start helping ourselves. I'd also just like to thank the whole panel for assisting us to better understand clinical depression, and for us to realize that there are many treatment options available, many modalities exist, and they have evidence-based research behind them. These could include medications and talk therapies, as well as all these other tools that we've heard of today. And if you're suffering, treatments that you're offered today may be different from what you were offered 5 years ago. As well, understand that treatments you could be offered might differ from what something would be offered to your friend. So there's many options. Not one works for every single individual. Also, I think it was really important, thank you, that we need to remind us that as dancers, we need to remind and help the physician or clinician understand our individual needs and what really our job and life as a dancer is and how that may differ from someone who works at a desk job. So in general, I think we want you to advocate for yourself. Also, we want to encourage you to seek out help if you or a friend are struggling. And we've listed below several websites if you need help yourself or want to find some help for a friend. So we have links to more information about depression and suicide risk. We have international links as well as links in North America. And we hope that this has been of help to you. I'd just again like to thank the panel today, and we thank you for joining us and look forward to seeing you again